Getting ready for another edition of Friday Night Football here, another high school game in the area. So it's time to talk to somebody who knows a thing or two about injuries and seeing injuries. We're talking to Jenni Aschoff, certified athletic trainer with Faith Regional Health Services. Thanks for joining us.
Thanks for having me here.
You betcha. Now, sprains and strains used interchangeably to describe everything from a twisted ankle to a pulled hamstring. What are some of those very two specific injuries? How do we differentiate?
A sprain is a tear or stretch or tear of a ligament, and ligament is a fibrous tissue that connects a bone to a bone in our bodies, especially in our joints. And a strain is a stretch or tear, but it's more specific to a muscle or a tendon, and tendons are what attach our muscles to our bones.
What exactly are some of the symptoms of a strain? How does that happen?
Again, a strain, is a stretch or pull of a muscle. So we see that a lot in sports with athletes, especially with contact sports or quick repetitive sports where they're doing a lot of the same actions over and over again. Their muscles get fatigued or they're overstretched or exerted, which can cause that strain to happen in that muscle.
So when we're talking about those specific injuries, what are some of the symptoms that pop up? If you just have maybe a little pain somewhere, maybe you see some swelling or some other kind of symptoms, what are those exactly?
As you mentioned, pain and swelling are, the more common injury or more common symptoms that we hear. But we also, one of the biggest ones we hear, or that we even ask people, did you hear a pop? Or they might even say, I felt a pop.
Certainly. So if you don't always hear a pop or you hear, something else that maybe goes wrong, when should you see a doctor or a healthcare professional?
First and foremost, no injury is ever the same. Someone might have done the same thing, but from injury to injury or even time to time, it's going to differ as far as their symptoms. I've seen athletes before that have sprained an ankle numerous times throughout the season, and each time they've been completely different because it depends on the mechanism of that injury and what areas of the area were injured. So basically, they can be treated at home with the rest, ice, compression, and elevation. But you should definitely seek a physician if you're experiencing any numbness or tingling, an increase of soreness or swelling when the injury initially happened, pain with walking or unable to put weight through it because this causes significant pain. We'd want to definitely rule out a fracture or anything that would require further imaging or possible therapy to repair that injury.
Well, let's hope we keep the sprains and strains limited for tonight's game. Jenni Aschoff, certified athletic trainer with Faith Regional Health Services. Thanks for joining us.
Thank you.